All right. Had a little bit of uh, startup problems today on the computer. I don't know how it got worked out, but I was able to work it out. So I'm sorry I'm 3 or 4 minutes late. All right. So I'm writing hello, TLC Health Freedom Tribe. God bless. And then we'll enter so that you can enter into the chat. And today's date is the 17th of February. 2026. This is Tuesday, and we are starting 6 o'clock every day. I mean, every week on Tuesdays till 7. Except today, I was 3 minutes late, so I'm sorry. I don't quite understand what was happening, but somehow we worked it out. So we do this every week. We're here to try and just talk about functional, alternative, uh, complementary, integrative medicine and answer your questions, try and get to you through our emails. We get these printed out right at the end of the day around 5 o'clock. So if you're on tlcdoctors.com, then you can get onto our newsletter, and then we'll give you a link to your email to our newsletter. And you can type in on that link a little question for each week that we're doing this. Now, the other way you can is on the live chat. If you type in and put your questions there, I will go to live questions typically first because you're here. The questions here on the email can be old. If I don't get to all of them at the end of every night or every Tuesday night, then I'll try and catch up and answer them at some point. We also put this on a blog. We have this transcript written, and you can go to our website, tlcdoctors.com, and go to the blog and look for the date of that. So we're trying to do this as a method to respond to generalized questions. This is not meant for any individual management through the YouTube. This is for educational purposes only. With my experience over the past 45 years and then my whole life with my dad in food research, Armor Food Research in the Chicagoland areas, I've had a really wonderful experience in the entire development over the past 60 years at least, 65 even, because I can definitely recall being 4 years old and hearing the arguments about the TV dinners and the trouble developing them when I was a little girl there in the Armor Food taste testing suite. And it was a very interesting way to grow up. So share, you can click like and share and subscribe if this is a help to you. And I'll try and answer anybody's question. You don't have to be a patient here at TLC, but we have a lot of patients that get general questions, and I'll do my best to answer. If I don't know, I will tell you I don't know. So we'll start tonight with the live questions. This is at Great is Thy Faithfulness. Well, hi, great is Thy Faithfulness. Let's see. And her question is, or his question is, I hear lots of talk on peptides. What can you tell me about them? Do you recommend them? Thanks. All right, so peptides are short snippets of proteins. So they can be 2 amino acid, 3, 4, 5. These very simple linkages of protein messages are able to do communication to cells, dock on them, and be recognized by the cell to have an impact. That is, for instance, the rage right now is the GLP-1 peptides that people are injecting to mimic or settle into the receptor sites in your body for the GLP-1 receptors, which tell your body you're full, you're not hungry, it slows digestion down. So that is an example of engineering peptides that have physiologic activity on the human body. You can make an argument that insulin is peptide therapy, and that was a wonderful therapy developed uh, when they discovered how to isolate insulin. Of course, that's a bit of a longer chain. But peptides also are involved in signaling from tens of thousands, if not millions, of activities throughout the human physiology. There are peptides that are BCP 157 is a popular one that patients are starting to come in taking to promote uh, energy, muscle growth, repair of the human body. But that sequence of amino acids, short peptides, can be achieved through exercise and fasting. The peptides can also be produced by eating a very high, uh, at least relative to what Americans have been doing. It's not really appropriate, maybe, to say high, but since we've been frightened from eating eggs and meat for so many decades by the uh, incorrect medical advice, now they're lightening up and they're not telling you not to eat eggs because of saturated fats, and they're not telling you not to eat red meat. When you eat that, you're going to get digestion of the proteins and the fats, and these will be a resource for your body to make all these signaling molecules. If you exercise, if you do intermittent fasting, which a normal lifestyle in a healthier time, people didn't have access to drive-in foods. They didn't have access or motion in the form of flying and cars up until about 100 years ago. Pretty much you were stuck walking somewhere, horseback or buggy or bicycling. And the impact of availability of a general store having something to get and eat was much more of an effort. So people ate far fewer refined carbohydrates, junk food, processed foods, hydrogenated foods, and they ate much more of a rich protein and healthy fat diet, and they had longer periods of fasting. They had better sleep cycles with day and light. They didn't have the light pollution and many other things challenging them, like pesticide, herbicide, fungicide, heavy metals, chemtrails, and just the stress of the daily news, electromagnetic airwaves. And so, our ability to repair and to eat those things, digest those things that make these signaling peptides for all the repair activities, is what the new marketing field for peptide therapies in various aspects of human physiology is banking on that you're going to use it. And I really think that there is a challenge to taking a peptide and thinking you're going to get a benefit if you're not eating enough protein, getting enough good sleep, uh, if you're not stopping eating early enough so that your own vagus nerve will shut off repair signaling somatostatin peptides in your body for repair, your lifestyle can defeat what that peptide is trying to do. You could theoretically uh, overeat against what the GLP-1 shots are doing. And then, not to mention all the potential side effects and the loss of muscle mass with that GLP-1, uh, Wegovy and Ozempic products. And there are just so many natural things that you can do. I am not in general support of all of this. I do understand the research for cell physiology and signaling, but to jump on and make a market without having enough doctors out there to explain good human lifestyle and physiology control to make a peptide have a chance of being beneficial. So I'm not recommending them at this point in general. So great is thy faithfulness. I'm going to say let's have self-control, and uh, let's understand our bodies, because I come from a Christian worldview. I think humans are intelligent and remarkable and capable of self-governing, and it is that wonderful capacity that gives us the ability, I believe, through the Holy Spirit, to help others and to discipline ourselves into trying to use our body that was created by God to bring glory to Him and His creation. That's how I approach my patient, inspire my patients, and really, we've done just fine here as a clinic for the past quarter century. 25 years we've been here, just doing wonderfully with probably some of the healthiest Medicare populations you'll find in the whole maybe in the whole world, but certainly in the United States after I went through that Medicare study for having effectually reduced the Medicare costs of my whole population of people who are at that age, just don't seem to need all the interventions, doctor visits, specialties, surgeries, medications, because they're using their agency to self control themselves, get a good sleep, get circadian rhythm, get light, get water, and all the things that go into living a healthy life without the expense of buying yet another marketed product. All right, that was a long answer. And great is thy faithfulness also said, also, what are your thoughts on genetic testing? I'm almost every week that I get that question. And I had one patient today who flew in from San Francisco. He likes to come and see me. Uh, he's in his early 60s, and he's wants to live long. He just became recently a grandfather of two children, and the third one's on the way. So he wants to be a successful man and live and be healthy and impact, for his children and his grandchildren, and even maybe great grandchildren. So he wants to live a long time. So he's saying, should I do all these testings for genetic SNPs and evaluations? And he's doing self-discipline with his life, with his exercise, his diet, the timing of his eating, his hydration, his circadian rhythm, sunshine exposure, certain nutrients supportively. And now he's worried that maybe we're going to miss some screening genetic SNP to predict a disaster of cancer or some disease. And I told him I don't recommend it. And I gave an example of just last week. I had a patient who did a total body scan, middle aged or a young man in his 40s still. And there were minor, non specific findings from his pituitary to his, um, where else? He had something in his spinal cord at the T12 area. And then we're talking 2 millimeters, 2 millimeters of something on this general screening MRI. And then he had something in his left femur, distal femur, an enchondroma. And then I forget what the fourth item was. But the long and the short of it is, none of this was in a man who had any complaints or anything wrong with his labs or anything wrong with his physical exam. He was a healthy man. And so now we're dealing with possible 2 millimeter to 4 millimeter lesions. And what do you do with it? Well, you make money if you do studies like this, and you refer up to a specialist, to the neurologist for the pituitary and the spinal cord, and you refer to the orthopedic for the femur little finding. All these things not considered of themselves, and it would say non-specific, non-specific. So I'm against these screening tests. I am for raising up a population of very good, well taught and experienced general practitioners, internal medicine, family doctors who will stay put in one area for decades to watch the patient over time and always be there. And then you'll have a doctor who knows you, who's keeping up with the sciences, who's available. And and I told the gentleman, I have no prediction that any of this will be significant because you have no symptoms. Of course, the place who did it recommended a repeat in 1 year. And I said you could see the specialists because the minutia of it all, I could not be predictive in any one specialty area without any symptoms. Or you could just choose to wait. But medical legally, I had to recommend that he be seen by specialists in the 2 or 3 areas of concern. So, um, he took the personal responsibility that he's not going to do anything, that he probably shouldn't have done that total body MRI. And we're going to spend all our time being available, living a healthy life, not eating a high carb diet, drinking enough water, exercising, getting sunshine, staying away from processed foods, taking a few nutraceuticals, doing labs every 6 months with a good body exam, hear how he's doing, see if he has any complaints. And that's called good medicine. That's called the best preventive medicine, is to have a general internal medicine family practice doctor in one place that's super fidelis, always there. And you can make a follow up with them. God willing, they stay healthy and alive themselves, and they know you. So that doctor is not someone out for money and uh, growth and fame and all this kind of stuff. They're there to take care of a population of people. And so, no, I don't recommend genetic testing. I don't recommend these total body scans. I don't recommend these screening ultrasounds or intimal thickness scans. I think your doctor and you should come to a plan or an understanding for cardiovascular prevention studies and lifestyle, for uh, cancer prevention and lifestyle, and just general well being. And then that's how to practice medicine. Remember, great is thy faithfulness, that out of the roughly 1 million doctors that are licensed to practice in the United States at the current time, that's about how many there are. About 800,000 of those doctors are specialists. 800,000. And so you're left with about 200,000 that are family practice, internal general practice, primary care. And very often that's an evolving group that's just um, uh, an abused um, uh, entity, the general family practice, internal medicine. They're not regarded in their uh, colleagues as valuable. They're like a triage nurse in an emergency room. Rather than that doctor saying, I'm here, I'm going to look into you, I'm going to read a little bit about you, this. I can't tell you how many countless times I've had a patient and they had a symptom or they had a lab, and I had to go back and study, refresh. I had to look back in my books. I had to do some YouTube study, get some PubMed articles, and think about that patient for the next visit. And it just makes you a better doctor. It makes you more informed, more capable. This is what we need, people. But we have a population and an ethos as a society. We've degenerated into medicine as a business instead of a ministry, and that you have to make a certain amount of glam and money as a doctor, or else why do it? Well, you know why you do it? You're called by God to love your neighbor as yourself. You're called to serve your family, and this is why you do it. This is why you're there. So that's a long answer again to genetic testing and these screening. Let you and your doctor decide. Do you really need that? Maybe the standard of care is to do something screening annually. Well, maybe you shouldn't expose yourself to so many X-ray mammograms or invasive testing. Maybe you should have another plan uh, and another monitoring methodology, or honor the patient's uh, history is so healthy. They are very unlikely to need as much screening. So that's what the practice of medicine is all about. And your patients should get healthy. They should be better than the average uh, patient population. They should have a healthier, longer lifestyle. Anyway, that's my thoughts on that. Okay. Beth. Beth says, I have a CT heart scan soon. Okay. So you're probably getting a coronary artery calcium score done. What are your thoughts on this test? Worthy to get as a benchmark of heart health? Yes, I'm going to say in general, yes. And there is a gentleman who was part of the development of the coronary artery calcium score, so that I think it was 1996 when they were first starting to really market this here in the United States. And the name of this scientist, he's a engineer. He's a biomedical engineer that worked with maybe it was a cardiologist, and they put the scoring for the coronary arteries on a CT scan. It'll show up as little, like a bone, like the calcium in a bone. It'll show some calcium in the coronary arteries. And that was, I think the first time I ever ordered one was around 1996 or 7 here in Newport Beach when I was with Whitaker Wellness. So I've been watching the whole field of coronary artery calcium score testing. And I found that I'm going to say what was more important was a relationship with a doctor and an accountability, and that doctor holding the patient responsible not to eat late at night, not to eat processed, refined carbohydrates, to get healthy, real food in their diet, enough protein and healthy fats, to have a certain degree of weightlifting, exercise, and cardio, to drink enough water, to take enzymes, to find out their blood type, to learn about inflammation, and to check those markers, their triglyceride, their HDL, their insulin, hemoglobin A1C, their weight, maybe their body mass, lean mass, fat mass, and get a good exam, once a year, physical exam with their doctor, or twice a year. And then set out a plan for keeping their insulin closer to 4 fasted, their blood sugar closer to 85 fasted, their hemoglobin A1C closer to 5.2 in the fasted state, and a triglyceride level around 50 to 75, with an HDL that nearly matches it at 55 to 70, 80. So when the HDL triglycerides are matching, that means you're exercising enough to what you're eating, you're balancing it. So those were the parameters that cost pennies compared to the coronary artery calcium score. Uh, and of course, you don't get the radiation of the CAT scan. Um, so I have mixed feelings about it. I've gone through all these years, and I've had people come to me with established coronary artery disease. We do chelation, we get their inflammation down, we hydrate them, we take their inflammation down with the enzymes, looking for food allergies, and they just don't get more heart attacks. They don't get more strokes. They don't do anything other than learn to exercise and do better and pass any of their treadmills, because I do refer to a cardiologist as necessary to get functional stress tests and so forth. And I just have wonderful, healthy patients who adopt healthy lifestyles rather than keeping on looking for a test is how bad is it yet? How bad is it now? How bad is it in 5 years? How bad is it in 10 years? I just don't want it to get worse. So the coronary scores, even if they come to me at the 300, 500, 900, 1,000, if we can level it out, because normally these coronary calcium scores gradually rise about year over year, about 25% of the base count. Uh, when we can see it's not rising, then we know we are doing the right thing and we're not worried. So that's my thought on the coronary artery calcium score. I'm not against doing it because I have ordered them myself, but normally I've been deferring to my cardiologist that I use is Dr. Kelly Tucker, who is a very sound and sober, good cardiologist, and he monitors it on the large number of the patients that I refer him to. But again, then he likes my patients because my patients are the best patients, and they're very obedient with taking personal self-responsibility. And that's the dream of a doctor, is to have good self-caring, managing patients. So, all right, so these are some of the questions here. Let's look at some of these now. Katharina said, I am 60 years old. I'm a TLC patient and trying to eat well and drink enough water each day. I don't know if I mentioned, we're Tustin Longevity Center here in Southern California, right next to Newport Beach. Is it normal to wake up once a night to urinate anywhere from 1 to 4 a.m.? Other than avoiding liquids in the late afternoon, are there any other things that would help to prevent getting up to go to the bathroom? Well, there's quite a few, Katharina. At 60, the lining of the female tiny short urethra and the thickness of the surface membranes of that area and the muscles are starting to recede and get flabby or petulant. It's harder to squeeze and do a Kegel and stop the urine flow stress signal. So natural hormone replacement therapy using some testosterone with estriol vaginally a couple of times a week, 3 times a week is very helpful to many women. But having good sleep hygiene, meaning if you have go to bed, and the best healing time is to go to bed around 9 o'clock, and then to get up before the sunrise so that you can wake up and do a few things and get ready for the morning sunrise. And you can be out there in your bare feet for a couple of minutes, letting those infrared rays come and go through your skull, through your eyes, through your clothes, and energize up the electrically structured water around your cell membranes and literally deliver increased membrane potential energy across all your membranes of your body. Then take a 15-minute walk outside, get your circulation going, and then come back and have some healthy protein, be well hydrated with electrically structured water. Dr. Gerald Polak has a YouTube on electrically structured water, well worth your time to study. Another thing is glycine. If you take 2 or 3 grams of powdered amino acid glycine, a half an hour before bed, that helps. Taking melatonin, that helps. But that light in the morning sunrise, the infrared waves, circadian wise, speaks to your optic chiasma and your certain area nuclei centers in your midbrain to give you a circadian rhythm sequencing so that you start to get appropriate cortisol bumps around 4 o'clock in the morning to wake you up, and then let that sunshine come in so your cortisol is a high spike and then goes away rather than a long prolonged stress sequencing. And then in the evening you will get around 8:30, 9 o'clock your first melatonin spike, which should start making you say, I'm tired. You really should not fight that and go to bed. So little things like the glycine, the hormones natural to help the urethral muscles around the urethra, the light, and then the melatonin circadian rhythm will help you get into a deeper sleep. If you use natural progesterone, that will help you sleep deeper and get more REM sleep. If you're on your natural estradiol, that will help you with your brain and your tissues and the thickness of the skin and the urethra there in the vaginal area. So there are many and several things that you could do that would be helpful. Those are just a few of the beginning things we would do. Jennifer says, I have heard you recommend not to take calcium supplements. What are your thoughts on taking a mineral complex supplement that includes calcium and magnesium? Bingo, that's the way to go, Jennifer, because remember, over the 45 years I've been practicing, I remember, in the 1980s, the bone densities were starting to be done, and we were seeing the drop in the mineralization of especially women and the hip fractures. And so I recall they would say, have them take 500 milligrams of supplemental calcium. So there'd be a calcium pill we would prescribe. I remember this clearly at Whitaker Wellness. And then the recommendation went up to 750. And then it went up to 1,000 milligrams of calcium. And then it went up to 1,500 milligrams of calcium. So they were making higher and higher recommendations because it looked from the 250, back in the mid 80s, all the way through the 90s, early 2000, it was not doing anything. And yet I have all these older women, including myself, 70s for me, 80s, 90s, and they have normal bone densities. Why? Because we start them younger, right around perimenopause. I don't think I ever really went through menopause because I always used hormones. So I never went through that big swing of loss of hormones. I knew as it was happening, I started using it. But we give natural hormones, even if you go a period of time after menopause, and you can build it back up. And then we check the vitamin D levels. And we just put the calcium in a very good amino acid chelated multi-mineral, which will include calcium, magnesium, molybdenum, potassium, zinc, boron, all these various healthy minerals. And ours is called TLC multi-mineral. The standard dose is 3 capsules. We'll give you about, a standard higher end dose of each of these minerals. Copper's in it as well. No iron. And I tend to use a double dose of that because the older I get, my membranes, I start to have weaker membranes just with aging, and my minerals will leak out, and I will tend to get cramps and so forth. But yeah, I think it's normal to often wake up once to start peeing, but you go do that and you start taking minerals so you don't get cramps in your muscle groups, and then natural hormones with your exercise, weight bearing exercises, you'll do better. So yeah, take a multi-mineral, not these individual calcium supplements that are god awful high. Plus, we believe that separate high dose calcium actually will deposit on your coronary artery or your soft tissues, and you'll get calcifications in your breast tissues, wherever there's little tiny micro traumas throughout your body. And then we have another live question from Lynn. Lynn says, hi, Dr. Rita, what are your thoughts on the difference in creams versus oral bioidentical estrogen? I like creams because they're much more manageable. When you take an oral tablet, you're dosed. You get the total dose of the milligram. I think oral estradiol comes as a 0.5 milligram, a 1 milligram, and a 2 milligram. And I like the creams because you can find whether it's on the inside of your wrist applying it, or to your face, or to your behind your knees, or in your groin. There's so many places that you might get good absorption with using the smaller doses. Now, some women don't absorb through their skin well. We're all different. I would say most women do, 80%, I would say, in my experience over the decades. But some women are just not good skin absorbers. And even though I'll take them up a little bit on their creams, if I can see they're not even absorbing with vaginal mucosal applications, which is right around the lips, the vulva, then I know they just don't absorb well. and then I go orally. I do not like patches in general because of all the plastics. For at some point, we have to start drawing a line and say anywhere we can stop plastics being absorbed through our skin, and the skin tends to be a big absorber of chemicals. So I don't like the patches. I do use them because patients really lean on me and say, "No, I want the patch. I like the patch." And I tell them the risk of the plastics, and they say, "Give it to me anyway." So that's what I think about that. So um, I don't see any danger with the oral estrogens. I've never, over the decades I've been doing this, I've never seen a problem. What I see the problem is doctors who give hormones don't take the time to talk with their patients enough and explain, look, I don't want to give you hormones if you're going to live a lousy lifestyle. If you're not going to take personal responsibility to exercise, to drink your water, to get a good night's sleep, to get some sunshine, to be eating healthy proteins and fats, and to take systemic enzymes. I want every woman that I have on hormones, including myself, on systemic enzymes because young girls have all kinds of enzymes. So, yeah, it's safe. Um, at Chun says, is it true that you need some cart to make testosterone? I don't understand the question there. Is it true that you need some carbs? Carbs to make testosterone? Absolutely not. No, there's no truth in that. I've never heard that. If it exists, I'm ignorant of it, and you would have to give me a reference, a article, or a lecture that I could listen to. But I have never ever seen that. Now there is a genre around the people who take testosterone in that they usually are men who are building up their muscles, women who are more physically active and exercising, and they link it with libido. Although it is for men, the libido is testosterone. It's not really for women. It is the estradiol that really makes the woman have a good libido. And in that sense, you have all this weight building, decades of weight builders talking about pumping carbs before a workout. And I think that's where the story gets confused about carbs being necessary when you're using testosterone. I don't think they're related. Damien. Hi, Damien. Good to hear from you. Hello, Dr. Rita. This morning I had 2 eggs and I added a can of sardines. Awesome. That's wonderful. I hadn't consumed sardines in decades. Do you recommend them? Yes, I think they're fine. Should I be concerned about mercury or aluminum in the can? Well, yes, we should because we live in a industrialized society, and all the waters of the sea have mercury now. Lead is in about 4 centimeters of all the topsoils and sands ever tested now in the globe. So we're in a toxic world. So we thank the Lord that we can do some chelation therapy. We can take the IV and get the heavy metals, gadolinium from a MRI scan with contrast. We can take the mercury out. We can take lead out from all the dust that gets into the plants from the ground. We breathe it, we drink it. So we're so thankful that we have chelation, but the value of eating small fish like sardines compared to the mercury in a shark or a big fish like a swordfish, it's infinitesimally higher levels of mercury exposure with the bigger eating fish that are eating the smaller fish. So I would say a sardines is a low risk choice, a high value protein, and for satisfying you. And I'm all in favor of it, Damien, and have had it and have them in my house right now. All right, the next question I have here is Carol. Carol said, I began taking creatine a few days ago. Half of the prescribed dose to start. The standard start is 5 grams, up to 20 grams. So she must have taken 2 to 3 grams. Within an hour or so, I began to feel lightheaded and dizzy. After I slept for an hour or more, I did feel better. Is it safe for me to continue taking it? Will the side effects reduce? Thank you for your help, Carol. Carol, I usually never, I don't think I can recall anyone who started using what we use is m- uh, uh, creatine monohydrate. That's the powdered form, tasteless white powder mixed in your water or your food. I put it in my yogurt. I take 5 grams a day, and I don't think I've ever had a woman say she felt lightheaded on it or dizzy. I'm not sure that that was the creatine that you took. There are different kinds of creatine. There are different manufacturers, some high quality, some with junk in it. If the one I have here is from Orthomolecular, a very high quality uh, company, nutraceutical that's been around 40 years, God fearing base. So I trust them. I've been to their plant a few times. So I know their quality of work. So I use a high quality creatine monohydrate. And I'm just going to say, I think you should try it again. And if your product is suspect, come and use ours, a known, clean, high quality, non foreign based sourcing for uh, creatine monohydrate, because that's new to me. I really haven't heard people complain of that. So give it another try, most likely. And then creatine will tend to help you retain water a few pounds when you start it. So I can't see it dehydrating you. Um, I just I don't know of a physiological biochemical pathway that creatine would be responsible for making you feel lightheaded. So let us know how that goes, or talk with your doctor about that and let them, I don't know what your other symptoms are or who you are. So maybe there are other issues going on, Carol. Um, Amela says, hi, Dr. E. Is it okay to take L-glutamine daily, long term, or should I take a break? It makes my digestion better. Amela, it should be fine to take the amino acid L-glutamine. We use it here in a product from Orthomolecular called Gluta Shield. Metagenics makes a product called, uh, what is the name of their product? But they have a amino acid glutamine based product. I think they put in some aloe and some zinc carnosine in it, or other products like that. But they're excellent. They're safe. I've used them for decades. I've had people using it for decades. I've had it in my house. I don't need it regularly, but no, I've never heard of a problem with it long term. John says, it's been said that high doses of vitamin C can be conducive to kidney stone formation with the oxalates. If true, do you consider that when recommending doses to patients who have such a history? I know the theory and the science and the biochemistry of oxalate formation and vitamin C, and yet, in the totality of the human being, in my experience since age 7 and 72 now, so that's 63 or so plus years, I have never seen a kidney stone generated in a human being from vitamin C administered intravenously. I just haven't. Hydration, drinking enough water, especially the new structured water. I hound my patients to drink half their weight in pounds as ounces of water every day. And I think Americans are notoriously marketed to drink and eat anything that entertains their mouth and lips and throat. And they're just entertaining this whole all the time, and instead of getting the things they need, they'll drink a diet soda or a soda pop or some smoothie or Slurpee, or it's foolishness. These seed milks like coconut water, coconut milk, almond milk, um, soy milk, and everything's got to be a gimmick. let's stick with what we're made of, water. And so most Americans are dehydrated. And so what will happen is they will move toward eating, let's say, potentially having a kidney stone. Let's say, potentially having a kidney stone because the American diet is so acidic and full of other irritating, inflaming components that the inflammation in the dehydrated state will tend to produce oxalate crystals in the kidneys. So no, I haven't seen it in all the decades of the tons of hundreds of thousands of high dose vitamin C's I've given, and all the colleagues from all the conferences I've attended. No, I just don't see it being a concern because I hound my patients to stay well hydrated. Then John says, do you agree that every health professional isn't always correct about every piece of advice? I agree all the time. Correct. In fact, I suppose if these doctors are going to be honest, and myself, many of the professors in the 1970s were telling me in medical school, half of what you are being taught in medical school for research and proclamations of care recommendations will be considered wrong in 50 years. So I'm right about at that point of seeing medicine over 50 years. And boy, can I tell you, have they been wrong? So what do you want in a doctor? You don't want a robot doctor who is just following protocols, standard of care protocols. You want an individual thinking, critical thinking doctor who you have a relationship with, who will have time enough reasonably to talk in your appointment about your unique body and self, your stressors, your life, your situation, and how you might modify that to improve your health, prevent disease, all those things. So, yes, you have to have a critical thinking, engaged personal relationship with a doctor who loves you. And I personally think your doctor has to have fear of God to go home every night thinking, I took care of your creation. Did I do it? Did I do a good enough job? Did I miss anything? And then he goes on to say, if so, have there been times in your 42 years when you had to make alterations to your advice? Yes. I was, what was I? Telling my oldest son, must have been 4. Yeah. Or 3. And my son Brighton, the second boy, was newborn or 1. And I was a flight surgeon on the Air Force base, the airfield. And I took care of Air Force fighter jet pilots, flew with them. I took care of the helicopter men, the fixed wings flights, the C-130s, all of them, got to fly with them all, learned how to fly myself. And in that period of time, I was being bombarded to use statins and lower cholesterol and, referred to the cardiologist. And I was on active duty. You have to remember, it's a little different when you're on active duty to be a different thinking doctor. Like I tried to add vitamin C to my ER patients with a stroke or with magnesium, and heart attack patients, magnesium to stop atopic arrhythmias, which often would cause their death from heart attacks when I was the ER doctor. So I tried to push the envelope then, and my father was pointing out the corruption of the medical system regarding the cholesterol saturated theory for heart disease. I was torn between my father and and the professors I knew at Armor Food Research and what they were saying, which was never mentioned in the news or in the standard healthcare of my training. And I had to realize that um, truth is suppressed when the people who own the pulpit and the media and the uh, biomedical industry make money off the lie. And so, for a short time there, I'd say about a year, while I was a flight surgeon, I was promoting and making my own little slides. I remember you put a slide in those little carousels, and I was doing training with my pilots. I wanted to have the healthiest flight line, pilots ready for active duty at a moment's call. I wanted to be known as the flight surgeon that had the healthiest pilots. And I did. It turned out I did. And I was teaching them, how to eat healthy. And I would, on these things, I was showing them how I was cooking. My husband and I were doing the Pritikin back at that time. And we were eating very low saturated fat. And I was wrong. And that's when these men had cholesterols of 430, 380. I mean, I'm telling you, these guys were the healthiest specimens with testosterone levels of, 1400, 1600, and they had beautiful, rich cholesterol levels. So I finally bowed my knee because I just could not get my fingers to prescribe a statin to a man who had not ever had a heart attack or a symptomatic problem. And it turns out the only possible value of a statin was a minor anti-inflammatory action, which my water was well overcoming the enzymes I told him to take, because I started even using um, uh, enzymes back with them at that time. I was bringing in some natural things, and I gave lectures to my flight and their family and their wives to be healthy soldiers. So yeah, I had to change my view on cholesterol in 1988, I think it was. Yeah. All right, maybe 87. Chuck says, what's the sugar grams per day before it affects your diet? A man should not have more than 9 teaspoons of sugar, and a woman shouldn't have more than 6 teaspoons, which is roughly 36 grams of carbs of sugar for a man and about 25 for a woman. Um, and you guys in general are busting through that every day when you're eating in general. Uh, so that's their recommendation. It should be much lower. You need to work with a doctor who will say, here's where you're at. You can't follow the recommendations. The improvement would be so slow and so defeating that the patient would start to say, it doesn't matter, give me a drug. We have to see how much you'll be willing to self auto regulate your diet, how late you eat, how much you exercise, and do a test and see a nice drop in the insulin, a nice drop in your triglycerides, and you will feel better, you'll think better. So you got to work this out. There aren't protocols out there because that's for the mythical 70-kilogram man. We're all different. You have to have a personal, informed doctor who's going to be there for you through the decades, who loves you and God. All right. Kathleen says, I don't want to take pharmaceuticals, but doctors tell me I need to because of the very high cholesterol of every kind. My triglycerides, however, are good. I've tried every supplement, exercise, etc., to bring it down to no avail. What's your advice? Kathleen, you need to watch the video High Cholesterol is Healthy by Dr. Ken Berry and Dr. David Diamond, PhD. This has been blown out of the water to worry about that. And if you have lipoprotein little a that's elevated, I have that. Just take vitamin C regularly, 750 milligrams, 1,000 every day. That'll help bring it down. If your triglycerides are roughly in the 50 to 75 range, and your HDL is in the 55 to 75 range, and they're equal. HDL is exercise, and triglycerides is eating the carbs. When these are balanced and your triglycerides are way, way high, then you're going to live well. And I don't really care what your total cholesterol is. Find a good doctor, watch that video, work with them, and see that. I have all kinds of patients, and and my old pilots had the highest cholesterols, and they didn't have problems. And then Lynn says, "Hi, Dr. Ellithorpe. I do appreciate these talks. If it is, like and subscribe. Please remember to share and see if your family and friends can be blessed. It doesn't make me any money. I just do this because we love you." All right. So she goes on to say, last week you mentioned raw vegetables were damaging to the one cell membrane of the stomach wall. Uh, I eat dandelion greens blended in the blender with frozen fruit. Would these dandelion greens cause those micro tears in the stomach wall? Yes, they can. How how safe is lettuce greens to eat? Thanks. In general, all the plant kingdom has what we call anti-nutrients in them, whether they make oxalates like we talked about, whether they're phytates, tannins, whether they're uh, gluten or these products. These are made by the plant kingdom to ward off infections from molds and insects eating them out. Now, compared to a big human body eating a plant compared to a tiny insect or mold infecting them, virus infecting them, your body is going to be much more resilient. But we have so much marketing and so much repeat use of these smoothies. I don't like it. And anything you eat every day, most likely, if you're eating a standard American diet, you will have that repetitious food leak through your gut wall and you'll start making antibodies to it. So we teach a 1 day simple menu. You have your meat vegetable day, have that for your breakfast and your lunch. Then you have your chicken vegetable day, have that for your breakfast and your lunch. Then you have your pork and vegetable day, have that breakfast for and your lunch. Have your fish and vegetable day for breakfast and lunch. And then your body's not seeing all this chemicals and spices and variety and wearing out your 80% of your immune system. And Lena says, this woman, Asian woman, is 77. May of 22, she had sinus atrial tachycardia. She had side effects to all the medicines given. September 23, she was diagnosed with rheumatoid arthritis. Rheumatoid factor was 98. She refused to take the medicine methotrexate. She was managing it with diet and exercise. January of 26, her blood count was normal, except a little low white blood cell count at 3.5, which, I don't know who you are, but in general, I will accept a 3.5. And the rheumatoid factor already dropped back down to 55 from 98. And February of this year, her lipid test was normal. Her cholesterol, she said, was high at 205. That's not high. And your LDL was 131. That's not high in my book. But I would want to know you. Should I take Lipitor as per her doctor's recommendation? Watch the video. High cholesterol is healthy. I don't know you. I don't know your other situations, what your weight, your blood pressure, your insulin level is, how active you are. But I would say watch that video with Ken Berry and Dr. David Diamond. And in general, that level range of a cholesterol 205 and LDL 131 is not concerning to me. But I would have all my patients drinking the water, not eating late, pushing protein in their diet, exercising, weightlifting, getting up in the morning with the sunshine, getting their feet on the grass for 2 minutes, getting grounded, taking some systemic enzymes. Those are the things, and then they tend to do well. Let's see what we have here. Carolyn said, I eat eggs only occasionally and only the yolks because I had heard people with Epstein-Barr virus and autoimmune disease should avoid them. I would like to eat them more, but don't know if I should. Carolyn, I would certainly talk with your doctor. I see no reason why you can't have eggs. again, there's the person who eats the standard American wild diet, fast food, any time of day, late at night. They have all their excuses. Life was hard. They came home late. They got to eat, and then they inflame their gut. They get all the glyphosates and the lectins and the glutens and pesticide, herbicide. They get all these things irritating their bowel. So they're general inflamed from many things. So if you eat eggs or foods frequently, it'll leak through this irritated lining more so the older you get. If once you heal it up, then you can reintroduce these foods because these are usually IgG, which are the slow reacting foods, and you can heal from this. So you should be able to get back to eating eggs. And there are tests we can do that are specific for it. So have your doctor do that. And Lizette says, Amen, with a love and a heart and a smile. Thank you, Liz. Um, Gigi, I'm sorry. I have a weak LES, which bothers me mostly when I'm in bed lying down. LES, I have tried raising the head of my bed, but it's not helping much. What do you suggest? Weak LES. The anachronism, I'm not getting lower extremity syndrome. I don't know what that's standing for. Uh, but you have to have weightlifting and core. You have to get on the machines, do the crunches. You have to push the weight away from you. You have to pull the weight here. You have to do the leg press at your level of tolerance, leg extension, leg flexion. You have to build up your core. I would get a wrap. You can go to the drugstore and get a Velcro wrap and put it around your lower abdomen to support your core if it's lower extremity problems. But if you would type in what you're referring to, LES, because I don't have another computer and I have to bring this to an end now. But in general, that's the direction. We are fearfully and wonderfully made and can heal usually very dramatically. So see your doctor, maybe physical therapy, orthopedic. But in general, we have to do muscle exercise or we lose it. And the weight and the bone and ligaments start getting pulled out of place as we age. So that's what I would say. So with all that, I'm going to say good night and thank you. Like and subscribe, share it with your family and friends. And I'll see you next week, Tuesday at 6 o'clock. Thank you. Bye-bye.